John Macaskill-Smith here with me, Chief Executive of Pinnacle Ventures. So John, tell me a little bit about what you were presenting on today.
Look, I had the opportunity to sort of talk about the future and sort of what's coming in terms of how health services might be configured, in terms of how technology could assist people to use and interact with health services, and I guess about how we could move away from old models requiring people to come in, and I guess, you know, people being able to do more in their normal day-to-day kind of life using technology.
Yeah, and the first two introductory speakers also mentioned this, and you did, that it's all about people. How much do you think that the future of healthcare is going to be consumer-driven?
I think it's going to be almost completely consumer-driven, and I think that was one of the points that I was really trying to make, that I think, you know, particularly in Western health systems, we've kind of grown up you know, particularly in New Zealand where it's largely taxpayer funded, that we've kind of been grateful as a health system, and so we've also been a bit forgiving about how inefficient or how things might or might not work in it. But, you know, I do think we're all now moving to a much higher, you know, all having higher levels of expectations around how all services are kind of configured. I mean, we wouldn't sit around waiting for aircraft that didn't arrive, or be happy being booked in for a day that wasn't convenient, or, you know, buses that didn't turn up, or Airbnb rooms that weren't available when you got there. But you know, the health system's still got a wee way to go in terms of how it manages itself. So I really think consumers will start to drive things quite differently than they have in the past.
So obviously today, you know, you're talking to an audience of clinicians, people interested in digital health who are sort of in the system. How do you think they can keep up with that change and sort of stay ahead and embrace it while still being inside the system, which, you know, is still quite traditional in many ways?
Yeah, so look, a good example, so if you take Waikato Hospital about 9 years ago, a new CIO arrived. I remember him telling me that he'd discovered that there were 650 Microsoft Access databases that were unsupported by the central IT team, but were all mission critical to keep the hospital running. So I think it's a really classic example about how clinicians will silo off stuff, they get frustrated with the environment around them, so they build something for themselves. So I think what the system needs to do, and you know, players like the ministry and some of the regional organisations need to be much more active in ensuring that there are system-wide solutions that are put in place and not allowing people to drift off into their silos. I mean, things like the coding that's coming through, moving from Reed to SNOMED coding, is a massive shift, but it's also going to be an amazing enabler in terms of enabling the system to join things up a lot more effectively than we do at the moment.
And obviously key to the future being consumer-driven is consumers also taking more responsibility. Do you think that there is an appetite to do that, they just don't have the tools yet, or does that still need to come as well in terms of consumers taking more responsibility for their own care?
Look, our experience is that, you know, we opened up patient records to them about 6 years ago, and, you know, there was a lot of machinations about what could go wrong, and, you know, people were going to find all kinds of things, they weren't going to be happy, people were going to be emailing the doctor, you know, non-stop, and look, none of that's actually emerged. I mean, as patients have been able to access their own notes and their own health information, there's been a little bit of correcting in information, and which, you know, you'd expect. It's a file about me. If I see in there something recorded that didn't happen to me, I'd like that to be corrected. That's a good thing. But I think it's also enabled people to be better informed about their own health issues, so that they can take that to other providers rather than just having it locked up in one provider's system and them kind of being reliant on that provider to be the gatekeeper to the health system. So already I think we're starting to see, as patients gain access to their own health information, stuff's, you know, radically changing.
Yeah, that's great. Oh, thank you very much.
No worries. Thank you.
Cheers.